And we are back to the podcast version of BTV. I'm Marcus Boston.
And I'm Renee Boston.
And Renee is in here in the studio today. And for those who missed the question, if you're just joining us and you missed the question from the last segment, that question came to us from a 25-year-old woman who is expecting her first child, and right now her birth plan, right, Renee, is for a vaginal delivery, but she has some concerns regarding if she has to have a C-section, and she was speaking about some of the information that she had seen that C-sections can be sometimes unnecessary at the time. And Renee, I'll let you go ahead on.
Well, I think her biggest concern was not only let me start off. A C-section is a major surgery. It's like any other surgery. You're under anesthesia, and anytime a scalpel comes into play, that is considered a major surgery. So that is a big concern about a C-section. Another big concern about C-sections is whether or not they are medically necessary, and under certain circumstances they can be, meaning if someone is rushed to the hospital and the baby's in a breached or compromised position, or either the mother's health is in a compromised position, then at that point it becomes medically necessary to deliver the baby via Caesarean section versus a natural or vaginal childbirth. So sometimes it is and sometimes it isn't. The concern generally comes in when a healthy mother, expecting mother, near the 40th week mark, is brought with the idea comes to her from her physician about whether or not to have a C-section done. And this woman is healthy, her baby's healthy, there's no kind of compromised issues with the baby. The baby's lungs are in essence fairly developed because the mother is about 40, around the 39th, 40th week. In addition to that, there's no concerns about the mother having heart disease or preeclampsia or being pre-diabetic or anything like that, as well as there's no issues surrounding the baby and the umbilical cord or things like that. So everybody is healthy. So in that scenario where everybody's healthy and raring to go, and mother's approaching natural labor on her own, the question becomes, should a cesarean section be brought up, or should she consider that if everybody's healthy? And that was this young lady's concern, because she's heard horror stories about problems that resulted from a cesarean section, such as infection at the site, and infection, internal infection from either materials or either the what's it called, the site infections.
Yes. Mm-hmm.
In addition to that, there's also a possibility of very heavy blood loss, blood clotting. People also suffer from side effects from the anesthesia itself, whether it's they get sick from it, or there's an allergic reaction to anesthesia and you don't know it until it happens. Also, people are concerned about perforating colon and intestines during the procedure itself from the tools. That's always a problem.
What I would do is I want to jump in too, because I know we are in this last section of this podcast for today. And I guess the question for the listeners too is if you've got a person who's listening to this right now, and I mean, Renee, when does a medical malpractice attorney, when would a medical malpractice attorney step in a possible situation like this? Because I'm sure that's
number one, if the woman feels like she's being forced or coerced at some point into receiving a cesarean section, and on top of that, now that's also coupled with the fact that during the procedure she suffers from an irregular blood loss, meaning an ongoing or lingering problems resulting from the cesarean, and that's the biggest issue. If there are lingering side effects or lingering problems outside of the norm from the C-section, at that point, that's where a medical malpractice attorney may come in. Meaning she had a perforated colon or perforated bowel or bowel obstruction due to the procedure being done itself, and that wasn't caught in time or wasn't cleared up, or it just lingers. So if there's a lingering problem, this is when you may want to seek legal assistance.
And I want to, I guess we can expand on this a little bit. I'll let you go ahead, but especially because we get people who call us about perforated colons, perforated bowels. go in for gallbladder surgery, bile duct gets cut. What is really a lot of times, what are the big concerns when it comes to the issue of repair whenever we're talking about a lot of these things? Because you have what we have to always explain to people is that, okay, so the doctor or the medical professional does go in, and with some of these procedures, there are always risks that are associated with the procedure itself. But can you explain to the listeners the idea of making the mistake or cutting something that they're not supposed to cut, or doing something they're not supposed to do, not catching it, not repairing it, sewing the person back up, closing them back up, and pretty much sending them back on their way? Can you talk a little bit about that aspect?
You pretty much just did. That's the crux of it. Is in anytime there's surgery, especially in the abdominal cavity, there's not a lot of room in there. So there's a lot of organs in such a small amount of space. And anytime there's a surgical procedure done, whether it's laparoscopically or whether it's via an incision, there's always the risk that any organ can be nicked, cut, poked, or things like that. The issue is whether or not the surgeon realizes that a nick or a puncture had taken place, and whether he or she had repaired it properly at that time. They had to be made aware that, this is what's happened, and they caught it, and they were able to successfully repair it in a reasonable amount of time. And reason, while they're in there, there are proper procedures that surgeons have in place to kind of go back over any areas that they perform surgery on to kind of make sure that
nothing's leaking.
Right, nothing's leaking or nothing is cut that it wasn't supposed to be cut.
Right. So, and that is what we get a lot of calls on. Right. A lot of people have a lot of questions.
This is she asked a question in the form of, a pregnant woman and the possibilities of problems with the Caesarean section. But one of our major practice areas is surgical problems during abdominal surgery. So this is how it kind of comes into effect. Like I said, that area is so small and it's full of so many different organs, so many vital organs that a stray scalpel can do a lot of damage.
Right. And we just want to make sure that we make clear, because a lot of times a lot of listeners don't necessarily understand that the aspect of it is during a lot of these procedures, if you're having a colonoscopy, or like I said, you're getting your gallbladder removed, or even tubal ligations, things of that nature, things can get punctured and things can get cut. And again, we want to stress the fact that it's the repair aspect of it, because you even have some doctors that say, well, okay, yes, sure that there was a cut that was done, but because the treating surgeon or the treating medical professional saw it, noticed it, fixed it, closed it up, in other words, did the repair like they were supposed to, and the patient does not have any long-lasting effects due to it, that trying to be successful with a Maryland medical malpractice case is
pretty slim.
Yeah, it's going to be slim. So that's just something that we really want to stress. Is there anything else from this last question that you want to go back over? Because
I would just tell her briefly, anybody in that particular situation, whatever kind of surgery it is, understand that it is major surgery and there are always risks or complications throughout that surgery, but pay attention post-surgery, post-operative, that if there are any issues, like any kind of long-lasting or lingering effects of it, if there's any chronic bleeding, severe pain that is outside of the norm, if you've had the particular procedure before or something similar. So just pay attention to your body and what is if there are any long-lasting or lingering effects of it.
All right, that sounds really, really good. And is there anything else? If someone, Renee, wanted to contact you or contact us, if they have any questions, what would you tell them?
I tell them, give us a call, feel free, because we take questions like these and other questions pertaining to surgical issues, especially, as well as any medical malpractice issues in the state of Maryland. So give us a call, 301-850-4832. 301-850-4832, or for those that don't like to talk and rather send an email, feel free to send us an email at medicalinjury@bostonlawllc.com.
That's right. That's medicalinjury@bostonlawllc.com. And we also have, for those who just want some information, because we get a lot, if you're listening, you could be one of these people right now just listening, and you don't want to really get a lawyer involved with anything like that, but you do want some information. to try to understand this process here in Maryland. Renee and I have written a book that deals with some of the big things that you need to know before filing a medical malpractice case here in Maryland. So if you are a Maryland resident, in other words, you got a Maryland address that we can mail the book out to, you can either call us and ask, hey, I was listening to the podcast that Marcus and Renee did, and I want that medical malpractice book. Can they put it in the mail for us? You can either call and leave that message with us, or you can send it through the email. Just give us your address and we'll get that out to you. Well, Renee, the light is blinking for us to wrap up this segment. If you would like to have us to answer a question during one of our podcasts, just like what we're doing here today, you can send us an email at medicalinjury@bostonlawllc.com, or
give us a call.
You can give us a call, or you can send us an email at info@bostonlawllc.com.
Or you can send us a message through Facebook on our firm's Facebook
Right,
page.
you can send us a message, or you can just ask a general question there if you want to. If you're going to ask something on Facebook, just keep it general. We would say don't really get into specifics, because that is pretty open. So again, guys, thanks for taking the time to listen to the podcast today. I'm Marcus Boston.
And I'm Renee Boston.
And we will see you next time.
Bye-bye.
Bye-bye. You have just listened to a podcast from the trial attorneys at Boston Law Group, LLC. For more information, you can reach us at 301-850-4832. And if you would like us to answer a question in one of our podcasts, send us an email at info@bostonlawllc.com. Thank you and have a great day.
When your doctor acts as if you aren't even there, you deserve answers.